Hello, 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 everyone. We're just going to give it a minute or two. There has been unprecedented demand for this evening's webinar. We reached our capacity of over 1,000 registered, so it'll be interesting to see how many people end up giving up their Thursday evening to come and talk about mental health legislation for an hour. So I'm just letting people stream through. If you are a deaf or hard of hearing person, we do have ISL interpreters available for the webinar. So you might just need to change your viewing setting so that you can see myself or Sarah and the slides. So I'm going to keep an eye because we're very tight time frame. I want everyone to be finished up at 7 because it's a lot of information. And just to say at the start as well that these slides are very, very, very text heavy. We will share them with you afterwards, and the recording will be made available afterwards, with the caveat that this is a point in time while things are still emerging and some groups are still undertaking analysis. So just to let you know as well, we do have the Q&A function. So the question and answer function will be open. We won't be able to answer questions live. If even half of the registrants turn up, there's no way we'd get through all of them, but ourselves in Mental Health Reform and Dr. Charles O'Mahony will be looking at the questions and putting together a frequently asked questions piece. So don't worry if we don't get back to you today. You know, please do bear with us and we will get back to you next week. You won't be able to unmute yourself. I see I'm getting some notifications about people raising their hand. This is going to be just an information session. I have some slides and then we'll have a short panel discussion as well. So I'm just going to check on, sorry. So just to say, I'm going to start now because there's a lot to get through and I think people will join as they're coming along. But this is, we're calling it Webinar 1 because this is going to be an ongoing process through 2025. And this is the understanding the proposed changes to the mental health law, which is the new Mental Health Bill 2024 that was published on the 31st of July. So just to say, sometimes these conversations can be distressing. We're going to be talking about involuntary admission and detention and things like that. So just to say, if you need to step away, please do. I won't take any offence at all. There is support out there. And as I said, we'll be recording this and sharing the slides so you can come back and watch it at another time if you like. This is our agenda for this evening. So as I said, I'll have the slideshow now with lots and lots and lots of text and information, but that's going to be a resource for you afterwards. And then we'll have our panel discussion with the great panel that we have here, Justina, Charles, Michael and Anne. So we're not going to be able to get through all of the questions, but as I said, if we don't get to them today, we will be putting together a frequently asked questions piece and we will get back to people, or you can email me. You have my email through the registration process. We're recording it. And then, so the main thing to say here is this is Mental Health Reform's initial analysis of the mental health bill. We're not legal experts. We're not legislators. This is an information session, a public information session on some of the key changes. It's not intended to be taken as legal advice or to be giving specific information for any mental health professional. It's information for people accessing mental health services and their family, friends, carers and supporters. People providing services will I assume there will be other bodies and other key stakeholders that will be providing training sessions and webinars and seminars, including the Mental Health Commission and others. So this is very much just a starter, just to flag some of the proposed changes. But the main thing to know is there will be no changes overnight. There won't even be changes in 2025. It's also highly unlikely that there will be any changes in 2026. And I say this because I think there's some anxiety around that things are going to change very, very quickly around how people practice in their professions, and also how people receive treatment, or the involvement of the family members in the admissions process. So it's really, really important. Just take this, like, if this is the one thing you take with you, nothing is going to change in 2025. The bill still has to go through the whole legislative process, which takes a while, and then it has to be commenced, implemented, and operationalized. So if we use the Assisted Decision-Making Capacity Act as an example, that took about 2 years. There were transitional oversight groups set up with key stakeholders. The Decision Support Service had to work on codes of practice. There had to be open consultations on those. So there is still a lot of time before there's going to be changes, and there's still a lot of opportunity for people to engage in the processes. In saying that, this has been going on for over 10 years. Most of this bill comes from an expert review group that reported in 2015. And since then, there's been work on the bill. There's been more consultation. There's been a lot of opportunity to link in on the bill. So again, just to say, no changes overnight. And it's such an honor to have so many people interested in learning about this tonight, and to be talking about this historic, once in a generation piece of legislation. And what I'm going to do is, I've gotten a lot of emails and a lot of questions, and thank you to everyone who has done that. We'll touch on them in a little bit. But I would really like everyone to just, we're all here together. The hottest gig in town, never mind Oasis. It's all about the mental health bill tonight. So please, for the session, put yourself at the center. So think of, if this was me and I was in need of mental health services and supports. Don't think about a loved one, a client, a service user, someone that you've worked with in the past. Put all of those preconceptions and ideas out of your mind, and just think, if this was me, and this law was being changed now for me and for my rights. I would really, really appreciate that, because I think it's important that that's what we remember, that this is a law for thousands of people who receive mental health services every year. So because nothing is going to change overnight, I just wanted to let you know that on our website, we have a Mental Health Act 2001 toolkit. So it might be useful if you have my head open here and Sarah and the slides, and then if you had another tab at mentalhealthreform.ie, because you can see quite a few of our resources there. So if anyone isn't sure about the rights that you have right now in this moment, and that you'll continue to have in 2025 and probably continue to have in 2026, that toolkit is there for your information. I'm stressing this, and I'm stressing the fact that it's a very, very complex legal bill. There's 202 sections, there's 7 parts. You can see here it's split down into, definitions, guiding principles, and we're going to go through some of these in more detail. And then part 3 about involuntary admission, there's 4 chapters in that. Part 4 is all about under 18s. And in this bill, you're considered, so children is anyone under 18, but within Part 4, there are differences between under 16s and then 16 and 17-year-olds. Part 5, all about the commission. Part 6, regulation. And then Part 7, there's 6 chapters kind of thrown in about different pieces. So we're just focusing on the key changes that are most pertinent at the moment for people accessing services and their family, friends, and loved ones. So as I said, huge amount of positives, so much great stuff in this. And I really hope that any of the kind of concerns or worries that have been floating around for the last while, that we can put them at ease today and really, really get you excited about what a brilliant opportunity this is. The language is more person-centered. There's a whole piece around guiding principles. You know, people are given more empowerment and ownership in their treatment. We have to be listened to. We're equal partners in our healthcare and in our treatment. The community services are going to be regulated. There's closer alignment to the Assisted Decision-Making Capacity Act. You can have a nominated person or an advocate. Information has to be in a form and language the person understands. And I actually got a question today about whether that might include Irish Sign Language. And my interpretation of that is yes, if you need a translator, or if you need ISL, or if you need easy to read, that the information has to be given to you in a form and language that the person understands. The whole new section on consent for 16 and 17-year-olds, which will finally bring us in line with physical health consent for 16 and 17-year-olds. There's rights around individual care plans, and then for the first time, there's a statutory right for psychosocial assessments when you go up in front of a tribunal, which is going to be renamed as a review board. So this is what the slides look like. So we've done the kind of easy comparison, where the 2001 Act is what's there at the moment and will continue to be for another while. And the 2004 bill, because it's not an act yet, it's not a piece of law yet, it's the bill. These are the proposed changes. So you'll see there's some of them. And one of the big ones on this point is that intellectual disability and severe dementia are taken out of reasons for being involuntary detained. And we're moving away from the medicalized language, you know, where you're a person and you have a mental disorder, or you fulfill the criteria for involuntary detention. We're not happy with the term mental disorder. We wouldn't say someone is physically disordered, but that's what's in the bill at the moment. In the Act, the 2001 Act, there are no guiding principles. So it's still very much decisions can be made about you, without you. The 2024 bill has guiding principles for voluntary and involuntary people. So that's in section 9 and section 10 of the bill. In those guiding principles, there's a presumption of capacity. So again, unless you have to go through a capacity assessment, you have to be listened to. You have to be taken into account, even if that someone thinks you're making unwise decisions or doesn't agree with your decisions. There, you still have a right, like anyone else, to make your decisions. And so the assisted decision-making provisions will apply for the most part, and you'll see here, except for Part 3, Chapter 3, and throughout the bill, there are sections around, you know, if someone doesn't give consent and doesn't have capacity, you know, people might have to go to court, or the professionals might have to go and get legal interventions through the court to be allowed to give someone treatment against their will. But the guiding principles say all practicable steps must be taken to help someone make a decision, including in the form and language a person understands. And if this is something that's really, really new to you, I would ask you to look at the Assisted Decision-Making Capacity Act and look at the Decision Support Service, because right now people have those rights with a few exceptions. With involuntary detention and the criteria, you'll often hear of risk and treatment. So in the 2001 Act, it's 31A and 31B. The 2024 bill changes those. They're going to be now sections 12 in part 3. And you'll see here the pieces in blue that are new. So there's just adding some of the pieces to the definitions of risk. So risk is risk to life or health of the person or that of another person. And then the idea of if you're admitted, and will that reduce the risk to yourself, or would you benefit from the care or treatment that couldn't be given somewhere else? Now, this is around involuntary detention, which again should be the last resort. At the moment, about 2,000 people are involuntarily detained each year, and around 60% of them are readmissions. So there's something not working. We know we need to move towards the access to voluntary treatment and healthcare if and when we need it, and that involuntary should be a last resort. Involuntary adds to the trauma and the distress of the person and to the experience of the mental health professionals providing the care, whereas voluntary admission and voluntary services are going to be much more recovery focused. You know, again, you're all working together as part of your recovery and of getting better and getting well, and then, you know, ideally to access and healthcare in the community. So you will hear people talk about 12(1)A and B. Under the involuntary detention piece as well, there's a lot in this. Obviously, at the moment, the vast majority of applications for involuntary detention are made by the Gardaí. So over a third are made by the Gardaí. The expert review group that I mentioned that reported in 2015, their recommendation 36, was that only authorised officers should be allowed make applications for involuntary detention. And that is something that mental health reform has supported. In the bill, there are still provisions for family members to make applications for involuntary detention, and there's a mixed reviews on that from family members. The expert review group had said at the time that an authorised officer should be the outside professional who is brought in to make those applications, and that would be to ensure the family relationship or the trust relationship there with your family or loved ones isn't damaged because you're the one signing a person in. But I know some families did raise concerns around that time. The Gardaí can no longer apply for involuntary detention, but they can still be, at the moment, they can still be involved in the involuntary process in other ways. So if they think that you might fall under the 12(1)A category of risk, they can take you into custody and ask for an authorised officer to come and make the application. So that is something to be aware of as well. And we know that there's a pilot project in Limerick that hasn't started yet. And we know that, again, for your experience of your mental distress, a Garda cell is not the most therapeutic place to be. And even now, you know, ourselves, we're told to present to A&E or to your GP. So we'll see what happens with that one. Advanced healthcare directives are something, if you haven't heard of them, they're provided for under the Assisted Decision-Making Capacity Act, which came into law last April and is really, really important. So you can make an advanced healthcare directive. And we know that mental health difficulties can be episodic in nature. You know, sometimes you're doing really well in your recovery, then maybe you might not be doing so well, and you know that can continue through our lives. So to make an advanced healthcare directive and have your wishes and your will and preferences set down on paper means that if you do lack capacity at some point in the future, there's still a record there of what you would like to consent to or refuse, and they're very, very specific. There is a template on the Decision Support Service website. So you can, again, the consultant psychiatrists or the treatment can still look for a treatment order through the High Court. So again, there's always, I think people are saying, well, I won't, let's not reinforce any of the misinformation, but there still are ways and safeguards there that people will be given treatment if needed, but it absolutely should be a last resort. So the nominated person is instead of an advocate, but they could be a peer support worker, they could be a loved one. It's a really, really great provision in the bill, because you don't have to go to the meetings by yourself. You will have someone who will have to receive reports as well and information about your treatment. Capacity assessments then, sorry, I'm conscious of time. So just on this one, the psychiatrist will determine who undertakes the assessment, but it can be a different mental health professional involved in your care, plus a second professional not involved. So like that, the High Court approval is needed to override consent. This is one of the sections where the Mental Health Commission is going to have to prepare a code of practice. In total, through the bill, there are actually 8 codes of practice, 8 new codes of practice that the Mental Health Commission will have to work on and develop. And the bill does say that for each of those, there will have to be at least 30 days time of consultation. So again, that's what I'm saying to you about in the lead up and the run in to these changes actually coming into force. There's still going to be a number of opportunities to have your voice heard and to work with others and advocates on that. So part 4, which again is really really topical, really just absolutely amazing to have a whole new part for under 18s. So as I said, under 18s are referred to as children in the 2024 bill, but there are sections within it that split out whether you're under 16 with capacity, over 16 without capacity, giving consent, not giving consent, all of those kind of things. So if you're particularly just working with under 18s and you're looking at the bill thinking, where do I start on all this, just going straight to part 4 is a good place to start. And we spoke to the Ombudsman for Children's Office yesterday, and they're reviewing this and looking at this as well. So the 16 and 17-year-olds been able to consent to and refuse treatment in line with physical health care. So the Non-Fatal Offences Against the Person Act from 1997, that allows 16 and 17-year-olds to be able to consent to or refuse to physical health care and dental care. So all this is doing is bringing that age of consent for mental health care down to what is the international norm, what we have said to the UN Committee on the Rights of the Child, what has been said for years and years, again, going back to the expert review group, that 16 and 17-year-olds should be included in the conversations about their care. And again, this comes back to the piece around people being voluntary and all working together around, you know, the best supports and therapies and treatments for the person. And just on that as well, just to say, so last year, there were actually only 7 involuntary detentions for under 18s. And for a psychiatrist to get access to an involuntary detention, there's other, it's not the same as the process for adults. There are capacity assessments for under 18s. And then the 2024 bill actually strengthens the rights of the parent and guardian with the right to information of a general nature on the care and treatment of the child, to attend meetings when the child is under 16, and with the young person's consent if they're over 16. And it also says that parents and guardians must be involved in discharge planning. Now, obviously it says insofar as is practicable and where appropriate. There'll be sometimes, depending on the child's situation, that it won't be appropriate for the parent or to be involved. So I think, again, really, really positive, really great steps forward, so much more inclusive of that information sharing piece around parents and guardians. And again, we should all be looking towards what is best for the young person and what is best for your therapeutic relationship or your family relationship or your friend relationship, and working together. And that means getting access to supports and services at the earliest possible juncture. So this isn't, we want to be moving away from the crisis point and the firefighting that we have at the moment. And that is, we have that because our services are severely under-resourced and underfunded and have been for decades. So we can't make legislation based off resourcing. We make legislation, and we make the best possible legislation to oblige the state to put the resources in to our mental health services and supports. Again, within the other pieces, some of the key pieces, community mental health services such as CAMHS, community CAMHS will be regulated. That has been something that has been called for by the Mental Health Commission and others, particularly since the Maskey reports. There are regulations around care plans. So you have now have a right to an individual care plan, needs to be done within 14 days, needs to be recovery focused, care planning needs to be accessible. And again, and this is care plans for adults and for children. So these other pieces now are obviously coming out into the outside of Part 4 as well. And the psychosocial assessments have to be carried out on each involuntary admitted person by a non-medical mental health care professional. And that psychosocial assessment will be used in the review board. So it takes into account psychological condition, environmental and social factors, ability to care for themselves, other supports that may be required, such as housing and things like that. And again, this is really, really welcome when we're looking at the person in the whole, their holistic needs. The other few, so I've mentioned review boards a couple of times. So tribunals are changing to review boards. There will still be the 3 panels. Instead of a layperson panel, it's going to be a community panel. The timings of everything are being reduced down around renewal orders. So you used to, at the moment, renewal orders for involuntary detention can be renewed for 6 months at a time. That's going to be reduced down to 3 months at a time. So people will be getting reviewed by the review boards much more regularly. You also have longer time to appeal to the circuit court. You'll have within 28 days. The definition of treatment is another really interesting one. So at the moment, it just says medical supervision, but in the 2024 bill, that is expanded out into clinical supervision. So as well as that, you know, that treatment can include talk therapies, art therapies, music therapies, all of the other, it's not just treatment, does not just mean medication. And one of the pieces that I want to flag here that we're not happy with is that the review says that it should be 10 years after commencement, but the bill at the moment, the 2001 bill, was supposed to be reviewed after 5 years. And it has taken us until 2024 to get to a point that we're renewing and reforming the bill. So we would be saying like that 10 years is not the norm in legislation. So we will be asking for that to be reduced down. So a couple of things, top 3 changes that are absolutely amazing. So like, imagine again, you're the person who is accessing mental health services. So there are guiding principles. So you'll get to have a conversation, you'll get to be included in conversations about your care and your treatment needs and your situation. The Mental Health Commission will have a much larger regulatory remit. And again, that will need lead-in time, and they'll need additional funding. They'll need to hire new inspectors and staff and all of that kind of stuff. And the nominated person, the access to a person, your support person of your choice, it is great. We're still waiting. There's no, the bill is silent about admitting children into adult psychiatric units. So we need clarification on that. There's no mention of an independent complaints mechanism. And even though you have a right to a nominated person, it doesn't have a statutory right to independent advocacy specifically named in the bill. So the main things that we're looking for now is that it's debated at second stage and that it goes to committee stage. And that's when the amendments would happen. So second stage will literally just be people talking about the bill. And what we're looking for is a respectful debate and non-stigmatizing language to be used. So just on the FAQs, thank you so much to everyone who has been sending in questions. It's been really, really great. There's definitely a theme there around the questions been received. So just a couple of things is that, you know, we're a coalition of community and voluntary sector organisations. We're not legislators. The content of the legislation is dictated by the government and the Attorney General. If you want to contact your local representative about the bill, you know, we do have a resource on our website. We've had the #Reform MHA campaign for a long, long time. We have a lot of resources, including a human rights analysis on that webpage. That's where we're going to post anything that comes in that's updated over the next couple of weeks. And there's already a HSE consent policy in place, and the Assisted Decision-Making Capacity Act. So when that was being implemented, there were a lot of questions around the whole idea of next of kin and the right to make decisions on behalf of someone. The next of kin rights never actually existed and don't exist. So if you've questions about that, I would really recommend that you look at the Assisted Decision-Making Capacity Act, okay? You could be entitled to a decision support arrangement. You probably are, and the decision support service is the one that will do that. And then yes, the 16 and 17-year-olds, it won't change your opportunities to support your child. It will actually strengthen your rights with your loved one's consent to information. So before we go on to next steps, then I'm going to stop